Do not eat ginger. If you have these illnesses, if you consume ginger, be very careful. Watch this video to the end, as your health may be at risk. Ginger is widely known for its various health benefits and has been a cherished remedy for centuries, treating issues such as digestive discomfort and nausea. Despite frequent praise for its therapeutic properties, there are specific situations in which caution should be exercised when consuming ginger. By understanding these circumstances, you can make informed decisions to maximize the benefits of ginger, ensuring your overall well-being. It is important to emphasize that the information presented in this video is unbiased and the result of extensive research and studies on the subject. So, let's now delve into the 10 situations in which it is not advisable to use ginger, with the last one being the most important. Number 10, blood thinning. If you have a bleeding disorder, it is essential to be vigilant about your diet. Ginger has a property known as blood thinning, and it can potentially worsen bleeding in individuals already prone to such disorders. While ginger is widely used as a spice and herbal remedy for various ailments, its active compounds, including gingerol and chelate, exhibit antiplatelet and anticoagulant properties. These elements can interfere with the body's natural clotting process, leading to prolonged bleeding and worsening the condition in people with bleeding disorders. Individuals with bleeding disorders should prioritize consulting their healthcare professionals before incorporating ginger into their diet. Healthcare professionals can provide personalized guidance based on each person's unique health profile and the severity of their bleeding disorder. It is crucial to consider these factors to ensure proper management of the condition and minimize potential risks associated with ginger consumption. Number 9, blood sugar reduction. Ginger, known for its potential to reduce blood sugar levels, may have advantages for certain individuals. However, for those actively managing diabetes, caution is advisable as abrupt drops in blood sugar levels can induce dizziness, weakness, and even fainting. Therefore, carefully monitoring ginger intake becomes crucial for diabetics. Additionally, as mentioned in the previous topic, ginger has natural blood thinning properties, which, while advantageous for those with normal clotting function, may pose challenges for diabetics already dealing with coagulation issues due to their condition. Number 8, digestive issues. Excessive consumption of ginger can potentially worsen concerns about blood clotting, leading to complications. Furthermore, diabetics may face digestive issues when incorporating ginger into their diet. Despite ginger's known ability to stimulate the digestive system, its consumption can result in discomfort, bloating, or worsening of existing digestive problems. This, in turn, introduces additional complexities in diabetes management, especially when gastrointestinal disturbances have the potential to unpredictably impact blood sugar levels. Therefore, a cautious approach to ginger consumption is advisable for people facing diabetes. Number 7, it can stimulate excess bile production by the gallbladder. Issues with the gallbladder arise when it doesn't function optimally, resulting in difficulties in the efficient release of bile, a crucial element for fat digestion. The natural spiciness and pungency of ginger can potentially stimulate bile production in the gallbladder, causing discomfort and worsening the condition. Additionally, ginger's potent anticoagulant properties may pose risks for individuals with gallbladder issues, as complications in this delicate organ can lead to bleeding and other serious health problems. Despite the celebrated anti-inflammatory and antioxidant properties of ginger, individuals dealing with gallbladder issues should approach its consumption with caution. It is advisable to consult a healthcare professional before incorporating ginger into the diet, as it may potentially worsen symptoms and hinder the healing process. Opting for alternative options that soothe and are friendly to the digestive system, such as chamomile or peppermint tea, may be a safer choice for those looking to manage gallbladder problems without exacerbating them. If you're enjoying the video so far, before we move on to the next topic, don't forget to click the like button and subscribe to the channel to not miss any videos discussing your healthcare. Number 6, people with heart conditions. For individuals managing heart conditions, incorporating ginger into their routine may pose certain risks. This is mainly attributed to its potential impact on blood circulation and blood pressure. Ginger is recognized for its properties that can improve blood flow, potentially increasing heart rate, which can worsen existing heart conditions. Furthermore, ginger's natural blood thinning attributes may pose challenges for individuals already taking anticoagulant medications. While the natural blood thinning effects of ginger may be beneficial for some, the combination with medications can intensify this effect, leading to complications such as increased susceptibility to excessive bleeding or bruising. It is crucial for those with heart conditions to act with caution when considering the inclusion of ginger in their health management strategy. Number 5. Incompatibility with some important medications. Individuals using specific medications, especially for blood clotting, high blood pressure, and diabetes, should exercise caution regarding potential interactions with ginger. The natural properties of ginger, known as gingerol, have the ability to thin the blood and reduce blood pressure. Therefore, individuals taking medications for these conditions should carefully assess how ginger may impact the effectiveness of their prescribed medications. Consuming ginger alongside medications like warfarin or aspirin, especially those intended for blood clotting, requires vigilance as it can intensify blood thinning effects, increasing the risk of bleeding. Additionally, individuals relying on medications to regulate blood pressure or diabetes should be aware that ginger has the potential to influence blood pressure and blood sugar levels, potentially causing unpredictable changes that could compromise the intended effectiveness of their prescribed treatments. It is essential for people to be aware of these interactions to avoid unexpected health complications. Number 4. Loss of appetite. Ginger is recognized for its potential to aid digestion, reduce nausea, and alleviate inflammation. However, its natural properties may inadvertently present challenges for people seeking to gain or maintain a healthy weight. The main concern arises from ginger's ability to stimulate the digestive system, resulting in increased production of digestive enzymes and potentially a faster metabolism. While this may be beneficial for many, it can lead to a decrease in nutrient absorption for those trying to maintain a healthy weight. Increasing metabolism can make it difficult to consume enough calories, and ginger's potential to suppress appetite can exacerbate this issue. For those struggling with low weight, it is advisable to consult a healthcare professional or nutritionist for dietary guidance. Although ginger offers various health benefits, those dealing with low weight concerns should exercise caution and explore alternative options to effectively manage their weight. Number 3. Risk of miscarriage. During pregnancy, some studies suggest that the consumption of high doses of ginger may potentially increase the risk of miscarriage. Therefore, it is advisable to exercise caution and moderate ginger intake, especially in the first trimester when the risk of miscarriage is comparatively higher. Additionally, ginger has anticoagulant properties, and its consumption may affect the clotting process, raising concerns during childbirth or related procedures, potentially resulting in increased bleeding and presenting challenges during delivery or postpartum. Despite its numerous benefits, ginger can also trigger discomfort and heartburn for pregnant women, especially those prone to gastrointestinal issues. Faced with these potential complications, it is recommended to consult a healthcare professional before incorporating ginger into the diet during pregnancy. In essence, while ginger can be a valuable addition to a healthy diet for non-pregnant women, its consumption during pregnancy should be approached with care and awareness. Prioritizing regular consultations with a healthcare professional and maintaining moderation in consumption can significantly reduce any associated risks. By staying informed and attentive, expectant mothers can make conscious decisions about their dietary choices, protecting both their well-being and that of the developing child. Number 2. Risk for individuals with low blood pressure. Low blood pressure is influenced by the active components in ginger, such as gingerol and zearine. These compounds play a crucial role as vasodilators, expanding blood vessels and leading to a subsequent reduction in blood pressure levels. For individuals already dealing with low blood pressure concerns, the consumption of ginger may worsen these symptoms, emphasizing the need for caution. Additionally, it is essential to note that ginger has the ability to stimulate the production of specific hormones and neurotransmitters, including serotonin and norepinephrine. This stimulation has the potential to contribute to further decreases in blood pressure. This psychological response can have adverse effects, especially for individuals predisposed to sudden drops in blood pressure. Therefore, a careful approach to ginger consumption is advised to minimize potential complications. Now let's move on to the last and most important situation in which ginger consumption should be avoided. Number 1. Increased risk in surgery and postoperative period. When preparing for a surgical procedure, careful consideration of certain foods and supplements is essential to avoid potential complications with anesthesia and medications. One such concern is the interference that items like ginger can have with the body's response during surgery. Ginger has been associated with an increased risk of excessive bleeding, which can complicate the surgical process and elevate the chances of postoperative problems. Furthermore, ginger has the natural ability to impact blood sugar levels, posing a challenge for people with diabetes. This interference can disrupt the regular intake of insulin, leading to fluctuations in blood glucose levels during the surgical procedure. Maintaining stable blood sugar levels is crucial for a successful surgery and a smooth recovery process. Healthcare professionals commonly advise patients to refrain from consuming ginger, whether in the form of supplements, teas, or as a culinary ingredient, at least 10 days before any scheduled surgical intervention. This preventive measure aims to mitigate potential risks and ensure the patient's safety and optimal well-being throughout the surgical process. In summary, while ginger is a versatile and healthy spice with numerous benefits, it is crucial to be aware of situations in which its consumption should be avoided. If any of the mentioned issues apply to you, it is advisable to seek the guidance of a medical specialist before incorporating ginger into meals. If you enjoyed this video, then subscribe to our channel and leave a comment below, letting us know if you include ginger in your daily routine.